we know that the majority of COVID-19 infections are now spreading through social gatherings, and most of the cases are also among those under the age of 40. Joining me now for more on what's behind that trend is Dr. Saunia Ahmad. She is a director and psychologist at the Toronto Psychology Clinic. So, Dr. Ahmad, thank you for taking the time. Ontario recorded over 400 cases for the first time since June. What is the psychological impact of seeing a spike like this?
Well, I think a lot of people are feeling very disheartened and hopeless about this. I mean, we worked really hard to reduce the cases by socially distance, and we're hopeful that things would get better. And seeing that they're not, I think it's causing a lot of people to feel a lot of uncertainty, a lot of maybe even feeling quite sad and down because they can't engage in a lot of activities that they wanted to.
That's right. And so what do you say to people who are feeling a little bit down about that, who are starting to feel as though, all right, the plan that I had on the patio or the plan that I had to go and see some family, can't do it?
Well, I say that it is, at this time, it is really important for social distancing. I mean, we don't have a vaccine for COVID. We don't have a cure right now for COVID. The only thing we do have is our behavior change. And if we change our behavior, we can really continue to fight this virus. It is has a lot of negative consequences, as we know, for people's health. And I think I advise people to look into ways in which they can engage socially while maintaining a lot of the social distance guidelines. There are a lot of ways to continue to enjoy oneself and to continue to enjoy a lot of social events by following those restrictions.
What would you suggest? I mean, are you saying it's time to go back to the Zoom calls?
I think they have to continue, as what's been recommended by the government is to continue to follow the suggestion to stay within certain social bubbles, like really communicating a lot with each other about, well, who is interacting with who, and sort of making a sort of pact and agreement with people within sort of one's friend network and family network of who is sort of designated within a certain social bubble and stay within that. Because ultimately it will help each other as well as the general public. And also I think that a lot of times there are ways to continue to engage socially with a lot of social distance. I mean, the government hasn't shut down everything entirely, but is recommending that, look, you really sort of weigh what's most important for you right now, not necessarily having to go out as much as we used to previously, really being very selective and going out as necessary with a lot of those precautions. But it is understandable. I think a lot of people are truly, really quite fatigued by all the quarantine measures. It's been going on for very long, and I think a lot of people are starting to weigh the risks of COVID transmission against their desire to go out and engage socially and get on with things, because we really don't know when this is going to be over.
Is it also that, so there was the lockdown in the spring and then things started to open up, people got that taste of freedom, and now people are starting to feel like it's going to be taken away again? I mean, how do you kind of deal with that sort of collective roller coaster that we all seem to be on?
Well, yeah, I think definitely people are seeing when the cases start to go down. I think a lot of times people were starting to have a false hope that things, and a lot of people didn't believe that cases would go back, and they didn't heed the advice of a lot of health experts that said there will be a second wave. And I think we're seeing signs of that. And I think a lot of people's guards have come down and they've been going out more. And I think generally when we first shut down, it was hard. When you have a second shutdown, I do think it's going to really erode people's general morale. And it is very challenging, but I think sort of, again, advising people to understand that we got to maintain some consistency here. Like, yes, we have loosened the rules a little bit than previous, but we need to continue to stay safe. The message was not, when the government loosened the restrictions and allowed people to go out, the message was not, okay, go out, it's all good now. It's stay where necessary. You can loosen the restrictions as long as you're staying safe. But at this time, people have to continue still. The only way we have to fight COVID is to change our behaviors and to follow the social distancing guidelines.
Now, what do you think about some of the language that has gotten a lot tougher? There are new fines. There's language, John Tory yesterday saying the time for education is over. It's now time for enforcement. Basically kind of telling the police to go in and really be tough on people and to hand out heavy fines. What do you make of that?
I do think that by telling people to change their behavior, just like that won't necessarily lead to everyone changing their behavior. So there needs to be a consequence. And we know that generally it's better if we can have a positive consequence to change people's behaviors than a negative one, negative being, again, the tough love, the language, as well as the fines that are going to be applied to people if they break the rules. That is what's considered a negative consequence. However, that is I think right now, I think the government's seeing that as the only sort of immediate, clear, and tangible sort of consequence we can give people who are not following the rules, to make them change their behavior. I mean, a more positive consequence would be to sort of thank people, or to let them, or there's the knowledge that knowing that by them following the rules, they've led to a reduction in COVID. However, I think for a lot of people, that's not as clear and as immediate of a consequence, and that's why I think the government really needs to put these restrictions in place. I don't know if the language and the sort of the more sort of aggressive language is as necessary, but rather than, I think what's more important than even just the consequence is actually being consistent when applying the consequence. I have seen and observed that even previously when people were being fined for breaking the rules, it wasn't as consistent. Not everybody was being caught and fined. And so I think a lot of people are seeing some opportunities to break the rules and get away with it. I think what's most important is to have a clear and firm rule in place, and then to actually consistently apply it so people know that they can't just break the rule and expect to get away with it.
Dr. Ahmad, appreciate your time. Thank you. Dr. Saunia Ahmad is a director and psychologist at the Toronto Psychology Clinic. She joined us from Toronto.